What if the very tablespoon you've been adding to your water in hopes of protecting your blood sugar is quietly doing far less than it could simply because you're using it at the wrong moment? Most people think vinegar is either helpful or useless. They argue about whether it works or doesn't, but almost no one asks the more important question: when and how should it be used to actually influence glucose control in a meaningful way? I'm not talking about pouring it over salad. I'm not talking about random internet detox trends. I'm talking about a precise, structured approach to vinegar that can dramatically change how your body handles sugar after meals and even affect your fasting numbers the next morning. I'm Dr. Thompson. For over 2 decades, I've worked closely with individuals navigating the long-term consequences of unstable blood sugar. I've seen the progression from mild insulin resistance to full metabolic collapse. I've watched patients struggle with rising A1C levels despite taking medications faithfully. And through those years, I began noticing a pattern. Some of my patients were using apple cider vinegar, but the outcomes were wildly inconsistent. For some, nothing changed. For others, post-meal spikes dropped noticeably. A few even saw measurable improvements in fasting glucose. The difference wasn't the brand of vinegar, it wasn't the amount. It was timing, dilution, and method. Scientific literature has quietly documented that acetic acid, the active compound in vinegar, can improve insulin sensitivity and reduce post-meal glucose spikes by significant margins when used correctly. But used improperly, it can irritate the stomach, damage tooth enamel, and produce little metabolic benefit at all. The truth is simple. Vinegar itself is not the magic. The structure around it is. And over the next few minutes, I'm going to show you exactly where most people go wrong. Why? Their results stall, and the precise framework I use with patients to make vinegar work with their biology instead of against it. By the time we finish this conversation, you'll never look at that bottle in your kitchen the same way again. For most people, blood sugar problems don't begin with a dramatic diagnosis. They begin quietly: a slightly higher fasting number, a little more fatigue after meals, a doctor mentioning borderline levels and suggesting you keep an eye on things. It feels manageable at first, temporary, something you'll deal with later. But here's what I've learned. After more than 20 years working with patients struggling with elevated glucose, blood sugar rarely corrects itself. It follows patterns, and those patterns are shaped by daily habits. So small, they almost seem insignificant. When I first began noticing patients experimenting with vinegar, I was skeptical. I had seen countless health trends come and go. Supplements, promising miracles, powders claiming to reset metabolism. Most of them delivered very little measurable change. Yet, something about vinegar was different. A subset of my patients who were using diluted apple cider vinegar consistently showed modest but real improvements in their post-meal glucose readings. Not dramatic drops overnight, not cures, but measurable reductions in the sharp spikes that damage blood vessels over time. At the same time, others reported no change whatsoever. Some even complained of stomach discomfort. That inconsistency caught my attention. In medicine, when outcomes vary that widely, it usually means one thing: there's a variable people aren't accounting for. So, I began asking detailed questions. When are you drinking it? Before food? After? How much? Diluted or straight? Morning or night? With carbohydrates or protein? The answers revealed the missing link. The patients who saw benefits weren't just drinking vinegar randomly. They were unknowingly aligning it with moments when their bodies were primed to respond. Those who saw no results were using it at metabolically ineffective times. That's when I started digging into the research more seriously. Peer-reviewed studies examining acetic acid showed consistent evidence. When consumed in specific conditions, vinegar improves insulin sensitivity and slows gastric emptying, meaning glucose enters the bloodstream more gradually. In other words, vinegar isn't powerful because it's trendy. It's powerful because it interacts with real biological mechanisms, but only if you respect those mechanisms. And that is where most people go wrong. When you look at the scientific literature on vinegar and glucose control, something interesting appears almost immediately. The effect is not dramatic in a flashy headline-grabbing way. It is steady, measurable, and biologically consistent. And in medicine, those are often the most powerful kinds of effects. Acetic acid, the primary active compound in vinegar, has been shown in controlled studies to improve insulin sensitivity after meals. In simple terms, that means your cells respond more efficiently to insulin signal to absorb glucose from your bloodstream. When that signal works properly, blood sugar rises more slowly and falls more predictably instead of spiking sharply and lingering for hours. Some clinical trials have documented reductions in post-meal glucose spikes ranging from 20 to 35% when vinegar is consumed in the correct manner before carbohydrate intake. Other research suggests that evening use, when properly timed, may modestly improve fasting glucose levels the following morning by influencing overnight hepatic glucose production. Now let me be very clear, vinegar is not a cure. It does not replace medication. It does not reverse decades of metabolic damage overnight. But here is where its significance lies. A consistent reduction in post-meal spikes of even 20 points repeated 3 times a day, 7 days a week, month after month, can significantly reduce long-term vascular stress. That means less strain on small blood vessels in the kidneys, less glycation damage to nerves, less inflammatory burden on the cardiovascular system. When you zoom out and look at the long game of glucose control, small daily improvements compound, and that compounding effect can rival what we sometimes see when adding a mild medication to a patient's regimen. But here is the crucial distinction. The studies showing these benefits did not involve random vinegar use. They involved structured timing, proper dilution, and specific dosage. When consumed haphazardly, vinegar may do very little. When consumed strategically, it becomes a metabolic tool. And that is the difference between someone who says, "I tried vinegar and it didn't work," and someone who sees their post-meal readings gradually stabilize over weeks. The power is not in the bottle alone. It is in how and when you use it. Here's where most people get into trouble. They hear that vinegar may help with blood sugar, and they immediately assume that more must be better. So, they begin taking large amounts. Some drink it straight, others swallow it first thing in the morning on an empty stomach without dilution. A few add it randomly at night, hoping it will burn off the sugar from dinner. And when they don't see dramatic results within a week, they conclude that vinegar doesn't work. But the real issue isn't whether vinegar works. It's whether it's being used in a way that aligns with your body's metabolic rhythm. Used incorrectly, vinegar can irritate the lining of your stomach, worsen acid reflux, and even damage tooth enamel. I've seen patients develop persistent throat irritation because they were taking concentrated shots of it daily. That kind of misuse doesn't just fail to help your glucose levels, it creates new problems. Even more importantly, taking vinegar at the wrong time can blunt its potential metabolic benefit. If you drink it hours after a carbohydrate-heavy meal, the glucose has already entered your bloodstream. The opportunity to slow absorption is gone. If you consume it alongside refined sugar, the glucose load can overwhelm any slowing effect acetic acid might provide. In other words, vinegar does not erase poor dietary choices. It does not cancel out a pastry. It does not reverse a late-night dessert. And then, there's the expectation problem. Many people approach vinegar as if it should produce an immediate dramatic drop in blood sugar. They check their glucose once, see no huge shift, and abandon the practice. But metabolic improvement is rarely instantaneous. It is cumulative. It builds gradually as insulin sensitivity improves and post-meal spikes become less extreme over time. Over the next several minutes, I'm going to walk you through 3 critical mistakes I see repeatedly in patients attempting to use vinegar for glucose control. I'll explain why each one undermines results, and then I'll show you the precise framework that allows vinegar to work with your biology instead of against it. Because once you understand the structure, everything changes. To understand why vinegar must be used strategically, you first need to understand something about your body that most people never think about. Your metabolism is not constant throughout the day. It rises and falls according to internal biological rhythms. These rhythms influence when your body handles glucose efficiently and when it struggles. Insulin sensitivity is not the same at 8 a.m. as it is at 9 p.m. Digestion speed changes. Hormone levels fluctuate. Even the way your liver releases stored glucose shifts depending on the hour. In the earlier part of the day, especially during the late morning and early afternoon, your cells tend to respond more effectively to insulin. This means glucose can move out of your bloodstream and into muscle tissue with less resistance. As evening approaches, that efficiency declines. Your body becomes slightly more insulin resistant. The same meal eaten at night will often produce a higher glucose spike than if eaten earlier. Now layer vinegar into this equation. Vinegar works primarily through two mechanisms. First, acetic acid slows gastric emptying. That means food leaves your stomach more gradually and glucose enters your bloodstream at a slower, more controlled rate. Second, it improves insulin sensitivity at the cellular level, allowing glucose to be taken up more efficiently. But these effects are time-sensitive. If vinegar is consumed after glucose has already surged, the slowing effect is meaningless. If it's taken during a period when insulin sensitivity is naturally low and you're simultaneously eating a large refined carbohydrate load, the benefit may be overwhelmed. Think of it like this: your metabolism is a moving current. If you position vinegar at the right moment, it strengthens the current in your favor. If you place it at the wrong moment, you're pushing against the flow. This is why two people can drink the same amount of vinegar and experience completely different results. One unknowingly aligns it with their body's natural rhythm. The other does not. When you respect biological timing, vinegar becomes a metabolic assistant. When you ignore it, it becomes just another sour drink. And this timing principle is exactly where our first major mistake begins. Let me share a story that illustrates this perfectly. I worked with a gentleman named Samuel who was 70 years old when we first met. He had been diagnosed with type 2 diabetes nearly 8 years earlier. He was disciplined. He checked his glucose twice daily. He took his medications exactly as prescribed, and he had recently started reading about apple cider vinegar as a natural way to improve his blood sugar control. So he began taking it every morning. The moment he woke up, before brushing his teeth, before drinking water, before eating anything at all, he would pour 2 tablespoons of apple cider vinegar into a small glass and swallow it straight. No dilution, no food, just a quick shot followed by a grimace and a sip of water to wash it down. He believed he was being proactive, aggressive, taking control. But when he came to see me, his fasting blood sugar was still hovering between 165 and 180. His post-ref readings were even worse, often climbing above 220, and he complained of increasing stomach discomfort and a persistent burning sensation in his throat. When I asked him to walk me through exactly how he was using vinegar, I immediately saw the issue. He was using it at the wrong time, in the wrong form, and in the wrong context. By taking it on a completely empty stomach, he was irritating his gastric lining. By consuming it undiluted, he was exposing his esophagus and teeth to concentrated acid. And most importantly, he was taking it at a moment when it had no meaningful opportunity to influence glucose absorption because he wasn't eating yet. Vinegar's primary metabolic benefit occurs when it interacts with incoming carbohydrates. It slows gastric emptying and moderates the rise in blood sugar after a meal. But Samuel was taking it hours before any significant carbohydrate intake. We changed 3 simple things. First, we diluted it properly in water. Second, we aligned it with meals instead of empty stomach use. Third, we adjusted the dose. Within 3 weeks, his post-meal spikes dropped by nearly 30 points on average. The burning in his throat disappeared. His fasting, glucose gradually improved as overall insulin sensitivity stabilized. Same vinegar, different structure, and that difference changed everything. The first critical mistake is taking vinegar on a completely empty stomach and treating it like a medicinal shot. I understand why people do this. There's a certain psychological appeal to intensity. It feels disciplined, strong, decisive. You wake up, you take your vinegar immediately, and you believe you've already done something powerful for your health before the day even begins. But biologically, that approach is inefficient. When you consume vinegar without food, especially in concentrated form, 2 things happen. First, the acid hits the stomach lining directly. For some individuals, particularly those over 60 whose gastric mucosa is already more sensitive, this can trigger irritation, reflux, or discomfort. Over time, repeated exposure may even worsen gastritis in susceptible people. Second, and more importantly from a glucose standpoint, vinegar has nothing to interact with. Remember how acetic acid works. Its primary benefit in glucose control is slowing gastric emptying and reducing the rate at which carbohydrates are absorbed into the bloodstream. If there are no carbohydrates present, there is nothing to slow. There is no post-meal spike to moderate. The metabolic opportunity is wasted. Some people assume that taking vinegar first thing will prime the body for better glucose control all day long, but the research does not support that idea. The glucose-lowering effect is strongest when vinegar is consumed in close proximity to carbohydrate intake. There's another subtle issue. Taking vinegar alone in the morning may stimulate mild gastric acid production without providing protein or fiber to buffer it. In certain individuals, this can actually increase hunger shortly afterward, leading to larger meals and higher glucose spikes later in the day. The correction is simple but crucial. Never take vinegar straight. Always dilute it, and never treat it as a standalone ritual disconnected from meals. Its greatest metabolic advantage occurs when it is positioned strategically around food, not hours before or long after. If you've been taking vinegar as a morning shot on an empty stomach, you are not alone. But understanding this mistake is the first step toward using it correctly. And the second mistake is even more common. The second critical mistake is using the wrong dose and assuming that if a little helps, more must help even more. This is where I see many well-intentioned people quietly undermine their own progress. They read that vinegar improves insulin sensitivity and slows carbohydrate absorption. So instead of using a measured amount, they begin pouring freely. 2 tablespoons become 3, 3 becomes 4. Some even take it multiple times between meals without structure, believing they are accelerating results. But metabolism does not respond to excess the way people expect. Most of the research demonstrating benefit uses a very specific range, approximately 1 to 2 tablespoons of vinegar diluted in water, typically before or with a meal containing carbohydrates. That amount appears sufficient to produce the slowing effect on gastric emptying and improve post-meal insulin response. Beyond that range, the benefit does not scale upward proportionally. Instead, what increases is irritation. Higher doses raise the risk of stomach discomfort, delayed digestion in a way that feels bloated or heavy, and in some cases, fluctuations in potassium levels in individuals who already have kidney concerns. I've seen patients complain of nausea simply because they believed doubling the dose would double the results. It doesn't work that way. There's another subtle problem with overuse. When vinegar excessively slows gastric emptying, food can sit in the stomach longer than necessary. In sensitive individuals, especially older adults, this may cause reflux or pressure that discourages consistency. And consistency is where metabolic improvements are built. I once worked with a woman named Eleanor, aged 72, who had begun taking 3 tablespoons of apple cider vinegar before every meal. She had read online that it burns sugar. Within a month, she developed persistent stomach discomfort and stopped using it entirely. Convinced it was harmful, we scaled her back to 1 tablespoon diluted in a full glass of water before her 2 largest meals only. Her discomfort resolved. More importantly, her post-meal glucose readings began dropping by 20 to 25 points consistently. The lesson is simple. Vinegar is a precision tool, not a volume tool. Measured correctly, it assists your metabolism. Overused, it creates resistance, not in your blood sugar, but in your willingness to continue. And the third mistake may be the most damaging of all. The third critical mistake is believing vinegar can cancel out poor food choices. This is perhaps the most dangerous misunderstanding of all. Once people hear that vinegar can reduce post-meal glucose spikes, they begin thinking of it as a metabolic shield. They assume that if they drink vinegar before a meal, they are protected, that the acetic acid will somehow neutralize the effects of refined carbohydrates, pastries, white bread, or sugary desserts. But vinegar is not a magic eraser. Yes, it slows gastric emptying. Yes, it can modestly improve insulin sensitivity, but its effect operates within limits. If you flood your system with a high load of rapidly absorbed carbohydrates, the glucose surge may overwhelm any slowing effect vinegar provides. I've seen this repeatedly in practice. A patient will proudly tell me they are drinking apple cider vinegar before dinner every night. But dinner consists of white rice, sweetened sauces, and bread. When we look at their glucose monitor data, the spike still climbs dramatically, sometimes reaching 220 or 240. They're confused. They believe the vinegar should have blocked it. But vinegar can reduce a spike. It cannot eliminate one created by excessive refined carbohydrates. There is also a behavioral trap here. When people believe they have a protective buffer, they subconsciously loosen discipline elsewhere. They may eat slightly larger portions. They may choose more processed foods. They feel insulated. That false sense of protection quietly sabotages long-term progress. I remember working with a 69-year-old gentleman named Harold. He had started using vinegar before meals and saw small improvements, but he also began allowing himself dessert more frequently, rationalizing that the vinegar would handle it. His A1C remained unchanged over 6 months. When we removed the refined desserts and kept the vinegar structured around balanced meals containing protein, fiber, and moderate carbohydrates, his post-meal spikes dropped significantly within weeks. Vinegar works best as a companion to disciplined nutrition, not as a substitute for it. If you treat it as a metabolic assistant, something that fine-tunes an already reasonable meal, it can produce measurable benefits. If you treat it as a license to overconsume sugar, it becomes ineffective. And now that you understand the 3 major mistakes, it's time to move into the structured framework that allows vinegar to work properly. Before I walk you through the structured protocol, let me pause for a moment. If you're finding value in this conversation, I want you to understand something important. None of what we're discussing is about miracle cures or extreme interventions. It's about precision. It's about using simple tools correctly instead of randomly. That mindset alone can change how you approach your health. For years, I've watched people bounce from one strategy to another. A new supplement this month, a different diet next month. They're not lacking effort, they're lacking structure. And structure is what turns small actions into consistent metabolic improvements. If you've been using vinegar without seeing results, or if you've never tried it because you weren't sure how to do it properly, this next part is where everything begins to make sense. And before we go further, I'd genuinely like to know something. In the comments, tell me where you're watching from and whether you've ever tried vinegar for blood sugar control. I read those responses. They help me understand how far this message is reaching and what questions you may still have. If this kind of practical biology-based strategy resonates with you, consider subscribing. My goal is not to overwhelm you with complicated medical jargon. It's to translate physiology into simple daily actions you can actually apply. Now, let's shift from what not to do to what to do. Because when vinegar is used correctly, it follows a predictable framework. It isn't random. It isn't guesswork. It operates within defined windows where your body is most responsive. I call this structure the precision timing framework for vinegar. It's built around 3 strategic placements during the day. Each one has a specific biological purpose. Each one aligns with how your body handles glucose at different times. And once you understand these 3 placements, vinegar stops being a trend. It becomes a tool. The precision timing framework for vinegar is built around one central principle: position vinegar, where it can directly influence glucose flow, not hours before or long after the metabolic event has already occurred. This framework consists of 3 structured placements during the day. Each placement has a clear biological purpose. Each one interacts with digestion, insulin response, and hepatic glucose regulation in a specific way. Placement number 1 is the pre-meal stabilization window. This is the most powerful and most consistently supported by research. 1 tablespoon of apple cider vinegar diluted in a full glass of water consumed 10 to 20 minutes before a meal containing carbohydrates. Not 45 minutes before, not immediately after finishing the plate. Within that narrow window. Why does this timing matter? Because acetic acid slows gastric emptying at the moment food enters your digestive system. It reduces the rate at which carbohydrates move from your stomach into your small intestine. That slower release means glucose enters the bloodstream gradually instead of surging upward all at once. The insulin your body produces can work more efficiently under those conditions. Placement number 2 is the evening glucose moderation window. For individuals with elevated fasting blood sugar, a diluted tablespoon of vinegar taken before the final balanced meal of the day may help reduce overnight hepatic glucose output. The liver releases stored glucose during sleep, especially in individuals with insulin resistance, by improving insulin sensitivity during the evening meal. Vinegar may modestly reduce the morning fasting spike that so many people struggle with. Placement number 3 is the structured carbohydrate defense window. If you know a meal will contain a moderate carbohydrate load, perhaps rice, potatoes, or bread within a balanced meal, positioning vinegar before that meal can blunt the expected rise. It does not erase the carbohydrates, but it reduces the magnitude of the spike. Notice what this framework does not include. It does not include random shots between meals. It does not include excessive dosing. It does not include undiluted use. It is measured. It is timed. It is strategic, and when patients apply this framework consistently, the improvements become predictable rather than accidental. Now, let's break down each of these 3 placements in practical detail because execution is what determines results. The first and most reliable window is the pre-meal stabilization window. 10 to 20 minutes before a meal that contains carbohydrates, mix 1 tablespoon of apple cider vinegar into at least 250 milliliters of water. Drink it slowly, not as a quick shot. The dilution protects your teeth and esophagus, and the gradual intake allows the acetic acid to begin interacting with your digestive process before food arrives. When the meal follows shortly after, gastric emptying slows, glucose absorption becomes more gradual, and post-meal spikes are noticeably blunted. This is the window that produces the most consistent reduction in post-meal readings. The second window is the evening moderation window. This one is especially relevant for individuals whose fasting blood sugar remains stubbornly elevated in the morning. The liver releases stored glucose overnight, and in people with insulin resistance, that release can be excessive. When vinegar is used before the final balanced meal of the day, it may improve insulin sensitivity during that meal and reduce the glucose burden entering the night. The key word here is balanced. This is not permission for a high-sugar dinner. It works best when paired with protein, fiber, and moderate carbohydrates. Over time, this structured evening placement may contribute to lower fasting numbers. The third window is what I call the structured carbohydrate defense window. Life is not perfect,